Hospital for Special Surgery is one of the most prominent orthopedic institutions in the world. We endeavor to train our future leaders.
It's our job as leaders to make sure that the quality is outstanding.
The fellow will have extensive clinical experience in the OR, an outstanding experience in academics, be involved in research at a very high level. You have access to New York City to create a very unique, well-rounded experience. Fellows who come here will have access to the largest foot and ankle service in the country. The pillars of this fellowship are arthroplasty, sports, and very complicated reconstructive cases.
We have a tertiary referral network of services that we offer.
We'll see 2 to 3 professional athletes a week. If you can get these guys back, and you can apply that to your weekend athletes as well.
They're going to get exposed to minimally invasive surgery, trauma, pediatric, high-level cartilage procedures using stem cell technology.
Each attending has a very unique characteristic and style and niche, which makes it an incredibly well-balanced and opportunistic place to train.
It is a mentorship program where you will have access to each of the attendings on the service.
The fellow spends time with us in the clinic, seeing patients. They spend time with us in the operating room.
You'll learn arthroscopic approaches from one surgeon. You'll learn the latest techniques in flat foot reconstruction from another.
The fellows will have a graduated experience where they do more and more of the case, and by the end of the year, they're doing the full case.
You'll be able to do more total ankles in your fellowship than most busy practices do over 5 years.
When our fellows leave, they will have a really good sense of how to manage those patients before, during, and after surgery.
Our fellows have academic conference on Thursdays where the attendings present their most challenging and difficult cases so that the group can weigh in on what they think is the best treatment option.
We all go in and examine them. There's about 25 people in the room. And then we come back out and we talk about what we would do. We also have M&M conference 4 times a year that the fellows run.
So many of the attendings go to those meetings. Just hearing all these different perspectives about the best way to do things, you can really learn a lot that way.
The fellows will have fully funded trips to both the Academy and the AOFES meeting every year.
We have Journal Club. We choose a journal, pick a number of good articles from there and review those.
The focus on education and not just service is what really sets us apart.
Trying to decide who has a proper indication for intervention, either surgically or non-surgically, that's the art.
There are a number of papers that get published from this institution each year.
We ask each fellow to do one research project that they can present it at one of our national meetings and then submit that paper as a manuscript for peer-reviewed publication.
We have research assistants to help them, statistical assistants to help them.
And they will have access to our foot and ankle registry.
We collect every patient that comes in to get surgery.
We have approximately 500 total ankle replacements in the registry, which include preoperative and postoperative outcome scores.
We're joining the Orthopedic Foot and Ankle Research Network, which is our Foot and Ankle Society's national registry.
We've had shockwave machines since the beginning. We have a Phoenix laser. We use biologics, we use PRPs and fat stem cells all the time.
Biomechanics lab, our motion analysis lab, our BSEL lab.
We have a robot which we can simulate gait. So now we're getting real data through the robot, so we're able to give the team some feedback.
The most important is for you to take that knowledge and understand how you could apply it to your own practice. And if you understand how to critique the research, then you can use it to evaluate how you treat your patients.
When you're looking for a fellowship, I think it's important just to get a good feel from the place. You are going to be spending a year there.
One of the great things about HSS is you are a part of one of the very few freestanding orthopedic institutions in this country. It's really inspiring to be with the giants and legends in the field.
Such a nice, great collegial atmosphere among all the attendings.
Within orthopedic surgery, there are not that many women who practice, and then within foot and ankle, it's about 10%. However, HSS has always been inclusive.
New York is an amazing opportunity.
We have a lot of events year-round. A skating party at Rockefeller Center, and they get to go to the games in New York City.
Obviously, there's the arts, the theater, museums.
Everybody knows about the parks and the shows.
We provide housing subsidized near the hospital based on your family's needs. As soon as you graduate, it doesn't mean you're done. It means you're just part of our alumni program.
You can virtually go to any state and find an HSS-trained fellow or resident who will be able to provide you with insight into their practices, potential job opportunities.
We invite fellows back to go ahead and either help teach in our bioskills lab or come back for conferences. We really encourage them to call us and reach out.
That's part of our job, is to continue to educate the fellows after they graduate.
We also provide business lectures for our fellows so they are better equipped to handle the current healthcare environment when they start their practices.
Our fellows end up in a very busy, productive private practice all the way to a real academic career.
They're going to leave this fellowship being able to handle almost anything that walks in their door when they start their practice.
Anybody would be lucky to do their fellowship here.